It's sort of like your building is on fire. You as a firefighter, don't call your boss and say, can I turn on the hose? You've got to act. A public health emergency lets us all know that we have to take serious steps in confronting whatever that emergency is about. In the US, for example, it gives the government the ability to go around some of the usual systems to be able to address the emergency quickly. One great example is what's happened with the FDA. A few days ago, we were talking about having 70,000 test kits for the virus available. Yesterday, the FDA director said that they're working with the private sector and they're going to have 1 million test kits available at the end of this week. They're not going through the usual process of the FDA of approving the test kits. They're getting them out because this is an emergency. People can be quarantined. There can be events can be canceled by departments of health at the state level and the federal level. So there are many steps. Monies can be moved around in a different way in the federal government and state governments to address the emergency. We don't really know what to expect. Some of us expect that what happened in China is not likely to happen in the US. And the reason is that the Centers for Disease Control has implemented in the US a tracking system that China doesn't have. And what it means is that if I get tested and I'm positive for the virus, all the people that I've come into contact with in the last 7 to 14 days will be tracked and they will be tested. And in turn, the people they have been in contact with will be tracked. So we have that system. Italy has that system. South Korea, I believe, also has that system. So we don't expect the kinds of outbreaks that happen in China. There is some discussion that the coronavirus is like cold virus and flu virus is influenza. And one of the things we know about those viruses is that they are prevalent in the winter, but not in the warm climates, in the warm times. And so we're coming upon summer. And there is some discussion that the epidemic may die down as we get warmer. When you look at the maps of where the epidemic is occurring, it's occurring mostly in the northern hemisphere now. And so it may be because it's weather related. So like all cold viruses and flus, which are the same family of the coronavirus, the virus is not as stable during warm weather. The other thing that has been talked about a great deal is what's the expected death rate of this virus. And I think it's important to say that out of 94,250 cases that we've had in the world, 51,000 cases are considered fully recovered. So more than half the people that had the virus are already fully recovered. It's not a virus that kills everyone. It's worse than the common cold and maybe worse than the flu in terms of mortality rates. But mortality rates have been primarily in the elderly, higher in the elderly, maybe 2.5 or 3%. In the populations that we've tested, we've only tested people who have more severe symptoms. When we start testing more widely and we start testing people who have very mild symptoms and wouldn't necessarily come to a doctor, we may find that the mortality rate falls down to 1%.